Okay, I'm going to go ahead and start. I know we had a lot of folks registered. I'm hoping that folks will be coming, more folks will be joining us soon. But welcome. My name is Beth Folsom, for those of you that I haven't had the pleasure to meet yet, and I am the program manager at the Cambridge Historical Society. And before we begin, I just want to acknowledge that the Society's headquarters, the Hooper Lee Nichols House, sits on the traditional land of the Massachusetts people. So welcome to our first official program of the year we're asking, how does Cambridge mend? That's our theme question for the year. And I'd like to start by asking you to identify yourselves in the chat box real quick so that we can get a sense of who's here on the call. And a reminder as we do that you can certainly use the chat box to ask any questions that you have throughout the course of the evening, and we will relay those. I'm assuming a lot of those are going to be for our amazing guest, who's going to be speaking to us in a little bit. And I'd like to extend a special thank you and welcome to Society members who have made tonight's event possible. And if you want to consider joining our group, please just head on over to our website, which is cambridgehistory.org, and click on the support button at the top of the page. You can also sign up to receive our e-news so that you don't miss out on any other great future events like this. And a reminder that tonight's event is free, but donations, of course, are always welcome. And a big thank you to many of you who made a donation, and we really appreciate it. We also appreciate feedback. So after tonight's event, you will be receiving a survey asking you about the program, what you thought, how you liked it, and how we can make it better for next time. So please fill it out. It helps us a lot. We love feedback. We are joined tonight by Deputy Superintendent Pauline Wells of the Cambridge Police Department. I will give Deputy Superintendent Wells a proper introduction in just a little bit, but we welcome her and are excited to hear her speak about the police department's mask distribution program. We'll be doing that in just a little bit. And that leads me to my opening question that I'd love to have folks answer in the chat if you can, which is whether you have a favorite mask. Masks have become so much a part of our fashion and our day-to-day lives. And everyone I talk to seems to have a favorite for one reason or the other. Maybe it expresses something about themselves. And a lot of times folks have a favorite mask because somebody made it for them. Either they bought it from a fair or a vendor, or somebody handmade it for them. Marika has, yes, her lobster mask. Marika has many wonderful masks that were made for her by her mother-in-law. And she has one to match every outfit, every season. So I brought mine along. So mine is actually a Christmas themed mask. Green on the inside, but Christmas themed on the outside. And we have a family friend who is a professor of fashion arts at Framingham State University. And she sent out with Christmas cards to everybody. She sent a Christmas themed mask that she made, and not just one per household, but one per person, everybody that was on the list for the cards. So she handmade these for everybody and sent it as part of her holiday gift. So this is one of my favorites for that reason. So, okay, well, I'm going to start our program on a bit of a different note, although of course it also deals with fabric arts and handmade artistic endeavors that are donated. We're going to have a brief discussion of the Basket Club. And I know you're probably asking yourself, what is or was the Basket Club? So that is an organization that we actually at the Society have their records for this club. It was started in 1873. Many of you have probably heard of Emily Elizabeth Parsons, who was the founder of Mount Auburn Hospital. Emily Parsons was born and raised in Cambridge, and she served as a nurse during the Civil War. She served in various areas in different Union field hospitals during the war. When she returned to Cambridge after the war, she began a campaign to open a hospital, known at first as Cambridge Hospital. So in 1869, she obtained a charter for the hospital to run out of a private residence in Cambridge, but by 1872, it was forced to close due to lack of funding. It was reopened in 1886, and its name was later changed to Mount Auburn, but Parsons didn't live to see its reopening. Unfortunately, she died in 1880, but she always believed it would reopen. And in 1873, she founded the Basket Club to aid in this effort. I'm going to take a quick pause because I see that Anne has her hand raised, and I just want to see if she's got something that she. Oh, was that a mistake? Okay, just wanted to make sure. Didn't want to leave you hanging for the rest of the presentation. No problem. Okay. So you're probably now thinking, all right, I get this is a club, but why is it called the Basket Club? What's that name about? And the Basket Club got its name from the large basket of material and sewing supplies that Parsons placed in the middle of her parlor when the club would meet at her house. Its purpose was to sew linens, towels, nightgowns, and other items that would be needed when the hospital reopened. And in the first entry in the club's records, we have all of the record books that the secretary took notes in, very detailed notes of their meetings. The club secretary notes that, quote, early in the winter of 1873, the thought occurred to one of our philanthropic ladies, Miss Emily Parsons, that there might still be industrial talent unappropriated by the numerous clubs of Cambridge, which, if concentrated upon one object, might accomplish much. So there were all of these societies, clubs, groups, informal, more formal structured groups for both men and women, but particularly women's clubs that were doing various social service projects. A lot of them were religiously based. A lot of them had to do with the neighborhood that you lived in or the other clubs and social circles that you belonged to. The ladies met twice a month in the fall, winter, and spring, breaking for the summer, as many were traveling or in residence at their summer homes. Their records indicate that a typical meeting was comprised of anywhere from 6 to 16 attendees, and that the members took turns hosting the gathering at their houses. They would use their meeting time to sew items for the hospital that was to open, and as time went on, they would also make nightgowns, shirts, dresses, and other items for orphanages such as the Avon Home, which still exists under the Department of Children and Families in Cambridge, as well as for settlement houses and nursing homes, and sometimes directly for donation to the elderly or infirm who were homebound. The club records describe the items they made for donation as well-made, but simple and unadorned. They also raised funds for these organizations by creating and embroidering items for sale at the numerous charity fairs that took place throughout Cambridge in the late 19th and early 20th centuries. And these were usually household textiles, placemats, table runners, tablecloths, and quilts, and were often much fancier and more time-consuming than the items that they made directly for donation. So the thought was that folks would either purchase directly or bid on them at auction, and they would raise funds that way for the hospitals and orphanages and their other charities. Of course, the leisure time to attend these meetings, which were held in the afternoons, was only available to women of a certain socioeconomic class who did not need to work outside of the home. The club's membership was carefully cultivated, and its records reflect instances in which the ladies were eagerly exchanging ideas about whom to invite into the club and how to entice them. So it's actually funny because my last name is Folsom, and there happens to be an incident in the early 1900s where they are courting a Mrs. Folsom. We don't know her first name, but she's just known in the records as Mrs. Folsom, and they cannot wait to get Mrs. Folsom into their club. And she's come as a guest twice, but is she going to, take the leap and actually become a full-fledged member? And I don't know. She kind of disappears from the record, so I'm assuming she doesn't make it. It doesn't make the leap, but okay. So the club's membership was, of course, unfortunately, exclusively white and middle to upper class, and much of the talk during the meetings centered on the latest parties, weddings, and trips abroad, as well as an analysis of whose house or garden they had visited and how their home design and choice of food and drink measured up to the standards of the day. But soon after the club's founding, the ladies decided that they needed more substantial topics for discussion as they sewed. So they took turns bringing a piece of writing to read aloud while they were working. Their meeting records always include whose turn it was to read at that particular meeting, as well as who was to contribute next. So it was who hosted this time, who's hosting next, and then the reading responsibilities in every record. The pieces ranged from poetry by Longfellow to the plays of Shakespeare to philosophical essays by members of the Harvard faculty, as well as religious sermons, travelogues, and newspaper articles. So a huge range of subjects and types of reading. In one meeting, they often discuss current events, including local, national, and international issues. In one meeting, the ladies had a heated debate about the candidates for the Cambridge City Council, and at another, they lamented the strife that was brewing in Russia and wondered whether it would lead to civil war. The club therefore not only functioned as a service organization through which members could use their sewing skills to the benefit of those in their community, but it was also a place where the women of Cambridge, albeit a limited group of privileged women, could gather to discuss literature, politics, and the important issues of the day. On one issue, the members seemed to be of one mind. At a meeting during the lead up to the ratification of the 19th Amendment in 1920, all of the attendees agreed heartily that women must be given the right to vote. And in fact, they had some not so nice things to say about some of the men in their family. And if he can vote, why can't I? So that was pretty entertaining to read. During both the First and the Second World Wars, even before the United States formally entered the conflicts, club discussions often revolved around the war effort, and the club joined forces with the Cambridge branch of the Red Cross during both wars to knit and sew items for use by soldiers and civilians both at home and abroad. The club saw its membership wane in the years after World War II, and it disbanded for good in 1963. But its legacy remained strong, and obituaries for Cambridge women well into the 1980s and 90s often mentioned that their subject had been a member of the Basket Club. And the club records also indicate how much the personal connections forged through the creation and donation of these items meant to the members. They actually have, in addition to the record books that they kept for each meeting, they have tallies and locations of all the places that they donated, and they have correspondence, both what they sent as notes, copies of their notes and letters to the folks that they were donating to, and copies of cards and letters that they received back. So it was very clearly very important to these women, and they talk about kind of imagining as they're sewing these nightgowns for the children's home. They're imagining the little children that are going to be wearing them and how they're going to be cozy at night. And it's really very touching to see that these women clearly had a very strong sense of connection to the people that they were making these items for and donating them to. So this brings us to the second part of our program, which is on mask making and distribution during the early COVID era. And for that, we are very pleased to welcome Deputy Superintendent Pauline Wells. Deputy Superintendent Wells has served for over 25 years with the Cambridge Police Department and worked closely with members of the Boston Area Mask Initiative and other groups and individuals to collect and distribute homemade cloth masks to Cambridge residents. Deputy Superintendent Wells, thank you so much for joining us this evening. And let's start by hearing about the beginnings of this initiative. So how did it come about?
Well, hello, everybody, and thanks for having me. This is pretty cool to be here, for sure. Well, as part of my duties as Deputy Superintendent, I'm in charge of pretty much everything that's not related to what you see on the street, the black and whites riding around and cops going here and there. So everything else I'm pretty much in charge of, which is probably more than anybody else, really. But part of my duties during the COVID pandemic was logistics, and part of that is PPE, obviously, for the people in the police department. But we soon realized and figured out that it wasn't just us that we needed to take care of. It was pretty much everybody in the city. That's what we wanted to do. There was lots of sleepless nights for sure. This is probably, I think, in my lifetime, the hardest I've ever worked in my life. This past several months, it was at any rate. So, you know, it became clear that we were going to have to find PPE, not only for us, but for the city. And I didn't know how I was going to do that. You know, I would call different places and they would say, nope, no masks, nope, no masks, nope, no masks. So it was very, very difficult. But, you know, the light in all of this for me, for sure, was how everybody just banded together and everybody knew what needed to be done. And no matter how small the donations were, they just kept pouring in. We would get, you know, whether it was from businesses or from different faith groups, restaurants, but then there was the citizens, and that is what topped it all off for me. You know, there's one particular story that I would like to mention specifically. There was a couple from West Cambridge, actually, in Cochrane Park, and the husband there drove a cab. The wife worked as well. He was a translator. They're both Pakistani. But he was a translator in the U.S. Army in Afghanistan. But they had developed, the father had developed a friendship with one of our police officers years ago. And when the pandemic first started, he reached out to that police officer and said, my wife wants to make some masks for the police department. And so I don't know how she did it, and I'm gonna try to find the picture and put it up on my screen. But she made twice 200 black masks that says Cambridge Police on the side of it, which were, you know, I don't have one, and I'm very mad that I don't have one because when I went to look, I was like, oh, wait a minute, they're all gone because everybody wanted them. But that's just one, and they were people of meager means, you know, helping us at the police department. But not only that, there was other people as well, all over the city, who would come in every day. People would come in every day. I have this package for you. We need to, this can be for you, but also we want you to give it out to our residents as well. So with all the donations that we got from residents as well as businesses and others, I believe we gave out probably, you know, over 25,000 masks. Probably even over 30,000 masks during those first several months of the pandemic. If I can start with that.
Wow, that's incredible. I just can't even imagine that number. That's just mind-boggling. My real interest in hearing all of this and kind of grappling with what that must have been like. I love hearing about what it meant for people to make those masks, but I'm also very curious to know what it was like. If I understand correctly, every police officer was given a supply to give out. Is that true? Or at least most police officers. And I'm interested in any, reflections that you might have about how that worked to kind of, not that I'm sure there's many positive interactions that you all have with the community every day, but that is a real being able to not just say, you're not wearing a mask, you're getting a fine, you're whatever it is, but saying, here, this is something, not only this is something we're giving you, but this is something that somebody made for you. I'm just wondering how, your reflections on that part of the distribution piece.
Well, it's funny because there was a if you weren't wearing a mask, there was some sort of a fine. I think it was $300 or something crazy like that. But we had no, this is being recorded, I know, but we had no intention of giving out $300 fines in the middle of a pandemic. So from all the donations, and then I was able to get some. I found a company in New Hampshire that I could buy masks for a reasonable price. And the city was, I mean, obviously, the city has been unbelievable as far as, having the funds to be able to buy what we needed. But what we did was we put masks in every single cruiser that rode around. And we also have a couple of guys in our family justice unit that really spend a lot of time with our unhoused folks all over the city. And we would fill up their vehicles with masks and sanitizer and wipes, and they were able to give them out as well. And we also had 2 or 3 places around the city that we set up drive-up stops, and you could also come to the police station to pick up masks as well. We would have them in the front lobby every day, or different hours during each day. But I think, and then we also had masks were given out at when we would also give out food supplies, or we would be there while folks were getting food supplies, and we would offer masks as well. I can't tell you how appreciative people were, and how many pictures and how many smiles and how many different stories of having a police birthday party drive-by parade for someone who was 6, 7, or 8 years old, and having them look out the window and be like, whoa, at the beginning of the pandemic when really nobody was going out at all. And I know there's been a lot of, this is a difficult time for police and community relations. We realize that, and we wanted to make sure that people understood that they could count on us. No matter what, their opinions were, it didn't make any difference. And so we wanted to make sure that people understood that we were there for them.
Absolutely. I had read this about Boston, and I'm wondering if there was any echoes of this in Cambridge. I read that in Boston, there was actually some of the earliest handmade mask, making and collection efforts were done by various Asian community groups, churches, houses of worship, things like that, and that it really was a very targeted way to counteract a lot of the stereotyping that was happening, and the fear and real hatred that was happening around the beginning of COVID, being kind of marked in by some as a Chinese or an Asian disease. And so that was a targeted effort by those groups to really say, hey, not only is this not true, but we're in fact being of considerable service to the community. I'm not sure if anything like that happened in Cambridge, but I'm just curious if you saw anything about that.
Absolutely. And even as last week, we got another email from a Chinese business saying, hey, we have 1,000 masks that we'd like to drop off. absolutely. You know, and all through since the beginning of the pandemic, whether it be citizens making their own, some were, I remember this one particular Asian couple who brought Red Sox and Patriots, they made them and brought them to the police department, but many different Asian businesses, I mean thousands and thousands of masks were definitely dropped off by companies as well as religious groups and citizens as well. Absolutely. And to this day, like I said, they still come in. And even some of the businesses with not just masks, it would be food, even McDonald's, owned by or run by an Asian businessman, sent over, 50 Happy Meals on one day and 50 Happy Meals the next day. So yes, there was a lot of participation from the beginning all the way till now. So they've been there.
So I'm wondering, I'm sure that folks are have some questions that they want to ask either Deputy Superintendent Wells or some more general questions that folks have. I'd love to be able to open up the discussion if there's stuff that, I have tons of stuff that I can go on and on about and ask, but I wanted to see if folks in the audience had things that they wanted to say. And I'm trying to make sure that my view is of everybody. You're a small
Beth, it's Marika. Can I ask a question?
Yes, please do.
Did you find anything in the Basket Club records about the last pandemic or like any other like major public health crisis? Polio? I don't know, anything?
That's a great question. I actually did not find anything that specifically spoke to the influenza epidemic, which I was pretty surprised about. What the targeted health concerns that I really saw were mostly around the two world wars, and that was mostly what they were concentrating on. And it was very, I'm assuming, I'm kind of imagining these women as, older ladies. A lot of them talk about bringing their young adult daughters with them to a meeting, or so-and-so, went to this other lady's daughter's wedding or something. So I'm imagining that many of them, because of the leisure time and, that they're devoting to this, are older to some extent, but they're talking about how a young soldier is going to be wearing the scarf that they knitted next to his, over his heart as he's fighting in France. And, it's very, they're crying in their meetings, thinking about who's going to be wearing these things that they're making. And they're, it's very romantic in that way. And so the need for need for linens and other things in the front, hospitals on the front, is definitely a big concern for them. But they didn't have an influenza mention, which I was pretty surprised about. So
Well, it's just interesting when you say that. That's just the humanity that goes into that piece of fabric. And I think Pauline was saying that, that's people feel it when they give it and when they receive it. So it's that's remarkable. I mean, this has been just such a terrible, terrible year, and to have that little bit of humanity and be able to focus on it, I think it's something we need to sort of highlight and think about how do we carry that through after the pandemic.
Right. That's why we wanted to we took a lot of pictures with folks when they came in, because it was a big deal, and we wanted to make sure that they understood it was a big deal for us too. We were lucky. We were, believe it or not, working 12-hour shifts was better in my mind than not being able to go to work, or working from home. I don't know if I could work from home, but being able to go to work every day was I thought it was a great thing that we were able to do, and I was glad that we had to be there. And we wanted to make sure that people understood that we understood what it meant to them, and that we wanted to memorialize it. So it's definitely they felt very, very strongly about the fact that they had made it with their own hands, and they wanted to bring it, and it was pretty unbelievable.
I live in Framingham, and we had a ultimately not very successful but interesting endeavor. Somebody in a Facebook group was trying to help people track their masks. We also had a huge donation effort of handmade masks, but we had a very brief period where someone was trying to help connect the person that made it. It was like, post what your masks looked like, and then they were trying to match them up with the people who received them through the drive and everything. It didn't work out so well, but it was very interesting that there was that real, desire to know who got what you made with your own hands, which I think is pretty universal. And also, I think Deputy Superintendent Wells, I know you said call you Pauline, but I have to I have to be formal about it. I got to be respectful.
It's too long.
But I know that you talked about this, about being out of work versus working a lot. I think it's important to just note too that all of these things have popped up since the pandemic, all different ways of being creative and making things, whether that's, planting things in your garden, painting a wall in your house, baking bread, making masks, whatever it is. And that's born from a desire to help, certainly, and largely, but it's also born from a wanting to control something in your environment, right? Like doing something positive with all of that energy that you're having, especially if you're not able to work for whatever reason. And in the early days of the pandemic, a lot of folks certainly are back to work now that weren't in those early days, but just recognizing that it comes from that needing to feel like you're in control of something when everything else seems so out of control. And I also just wanted to mention briefly the quilt that I believe was finished in January and was a collaboration with Gather Here in Cambridge and the Boston Area Mask Initiative with, I believe it's something like 50,000 scraps. It's some huge number. That's too big. That can't be right. But an enormous number of scraps that were left over from making masks were made into this quilt of all different patterns and colors, and a really vibrant, beautiful quilt that was hanging up at Gather Here for a couple of months, and now as of March is in the front window, I think, of the Cambridge Public Library, the main branch. And even though you can't go in yet to use the library on the inside, you can still see it through the window. So I'd encourage folks to either look that up online or go visit it yourself. Very powerful statement. So,
Yes.
do other folks have, Helly, do you have a question?
I'd like to ask, how did the police department let people know that they had these masks and food and etc.? I mean, I never heard about it.
Well, I believe
maybe I just wasn't listening to the right place.
Mm-hmm. Well, the food was a city initiative.
Mm-hmm.
So we would go to those sites to hand out masks as the city was doing that initiative. But on our social media, quite often we send things out versus with the city, as well as on the police department social media as well. And people knew because we gave out 30,000, 30 or 35,000 masks for a long period of time, and we still are doing it. It's less often that people come and inquire about them, but the police officers still have them in their cars if people need them, and if they come across people who might not necessarily understand that there's a mask mandate, and we offer them those masks as well. So
good. Yeah.
Yes. And I wish, there's a as you know, with and this is a little off topic, but speaking about vaccinations, the city, we had a partnership between the police department, the fire department, public health. And if they would just give us the vaccine, we would have the whole entire city completely vaccinated. Just give us the vaccine. I mean, we had you know, we had it all set up in 3 different parts of the city waiting for them to give us the vaccine, and they just never did. So, I mean, we're doing what we can with those populations that are underserved, the elderly, and homebound. We're doing that, but when it comes down to a time where everybody's eligible, we could really have made an impact in the city and beyond if they would just give us the vaccine. A little off topic, but the shining star of my last year. So figured I'd throw it out there.
Yeah, absolutely.
Yeah. So
I'll just add a little bit of what I learned talking to the assistant to the president of the Mount Auburn Hospital. I had a question for her as well, and kind of wondering what, speaking of fiber arts and handwork, wondered if there were folks who had donated either shawls or blankets or other kind of physical, fabric things. And she said that the hospital was very strict as far as their ability to collect physical objects from folks, particularly soft materials, because it was hard to sterilize, and they still are. So they're not accepting those things. But what she did say is, as you mentioned, Pauline, the food issue, and just having folks not only take the time and the effort to actually donate food, but it had to be individually packaged.
Yes.
It had to be boxed. It had to be contained, and you couldn't just go to a bakery and get, half a dozen cupcakes and send them to an office. You had to individually do each one. And she said that it was really unprompted, and that these local businesses, these local restaurants, just in some cases were completely closed otherwise and opened, and their staff came in just to make meals and package them for the staff of the hospital. And again, I think that's something that taps into, what happens when you can't do what you love to do for work, and you can't channel that energy into something, that you're doing regularly. You want to use that any opportunity you can to do that. And then they also had the Chamber of Commerce, I guess, in Cambridge also did a drive where they would purchase either food or gift cards to local restaurants and donate that to the staff of the hospital, so that in that way, not only were the staff getting either direct deliveries of food or their ability to use gift cards on their time off, but they were also then supporting those local businesses that would otherwise have gone under in many cases. So that was really eye-opening. And also she spoke about the cards and letters and signs and things that particularly school children had made, and how important it was that those kept coming all the way through. And she talked about the most recent kind of massive delivery on Valentine's Day of this year, that those didn't just stop coming, they kept coming. And she said, particularly in the early days, it was really tough because they had to put a lot of signage up, and it was kind of harsh in its message, and all capital letters, and do not enter, wash your hands, wear a mask. It was very stark, and kind of, an alert was put up. And then next to it, you would have a glitter heart made by a second grader. We love you, healthcare workers. And just that kind of being able to put up something really lovely and homemade, and with a lot of thought and love put into it, next to some of the harsher things that they had to be putting up during the pandemic. So
yes, and for the hospitals during I want to say, was it Nurses Week, maybe? I don't know what month it is, but to have the parades go by with the fire engines and the police cars, and I had the opportunity to actually sing at both of the hospitals outside, and it was really, really, it was very cool, I have to say. Everybody came outside, and they were up in the windows, and then they had all the messages from the kids planted up on the windows so that everybody could see. And it was another cool part of this awful pandemic, you know. The city, I mean, I hope anybody who, you know, anybody who lives outside of Cambridge should be jealous of all the things that Cambridge has done during the pandemic, between paying people's rent and, you know, providing food and masks. And it's just been pretty amazing. People have come together so much. We still get things from every Tuesday. We get the fruit from the business down in Kendall Square, you know, still every Tuesday we get that in the morning, you know, so it's been pretty amazing.
Definitely.
Come on, nobody wants to ask me a question about getting a ticket or anything like that?
So I'll
I
pick
did
up.
have a question about, like, did social distancing, does it still make anything difficult, Pauline, for the police officers?
It does, because again, that is on me as well. So we used to have some 2-person cars, which that really maxed out our fleet. Everything was maxed out. It just seems, you know, you know, so we could only have 1-person cars. Everybody had to wear masks all the time. We had to close the gym at the police department. And that was from public health, because of when you're working out, the aerosolizing that goes on. So I'm in the middle of trying to open that now with, you know, with rules. So I should have it open in a couple of weeks. They're dying. That's the one thing that they're dying to get back to normal about. But yes, we had to call in, you know, I don't know how many, at the beginning of the pandemic, everybody was really good because everybody was scared that, you know, nobody knew anything about anything. They didn't know how it was, you know, how it was spread, and was it spread this way and that way. So everybody was scared. So everybody was pretty good at the beginning. But just towards the holidays, that's when we started to get hit with cases of COVID and cases of people being exposed. So, you know, 10 days is a long time not to have somebody on to working. And then when you have one exposure, 1 person with COVID, and you have 8 people that were exposed, then you know somebody wasn't doing what they were supposed to be doing and stay 6 feet away. But I think we've gone past that as well. Well, I mean, it obviously helps that we have 81% of us vaccinated, and I'm working to get that up higher as well. But yeah, it was definitely tough, and we had companies come in and have to, you know, clean different areas where people had been or been exposed. So it wasn't an easy time, but it sure was a learning experience for me, for sure, as to the capacity of humans. And that's my biggest takeaway from it, is just the capacity of humans to be human. So
I see that Lori has her hand up, so I want to give her a chance to go ahead and ask her question. Oh, you're muted.
Audio not on?
Oh, there you go.
Okay. I just want to say, this is where I was sewing masks, in this room. I was so scared last year, but it did make me feel a lot better. But I also want to say another thing, which is that my family, for a whole variety of reasons, not because we were exposed particularly, but because we had young adults coming in and out of the household all summer, we got tested a lot.
Yeah.
And the whole family, for time, I say that the police and fire department running the testing at the Galleria Mall was unbelievable. I felt so kindly treated. I feel like it went so well. I just hope you understand, and it's part of the city's organization, how much that meant to me as a resident, to have that free testing and to have the kindness and the efficiency and the, you know, basically the totally inclusive atmosphere that was going on over there, and still is. So thank you for that. I just want to say that.
I appreciate that very much. And, you know, there's always been jokes about, you know, the rivalry between Cambridge Fire and Cambridge Police, or any fire department or any police department. And we couldn't be closer. And I wish that you could see, and there was talk around, no pictures, no videos about, when we had set up the vaccination sites. But the testing, you're right, the testing is just phenomenal. I mean, it's over the top phenomenal. And when we had set up the vaccination site, if you could just be behind the scenes to see what went into it and how smart and how the initiative that went into setting up so that people could actually get their shot in private. And I just hope at some point in the next few weeks that things turn around and we're able to bring you in, not just for testing, but for vaccinations as well, because that program is just phenomenal. I can't say enough about it. The Cambridge Fire Department did an unbelievable job. Public health, I've never worked with public health before. And I feel like I want to go into public health now. For my next, I've been here for 28 years. Now I want to go and work in public health. It's absolutely amazing. And I just wish people could see what went on behind the scenes. It's really cool.
That leads
But thank
me,
you for that.
That's all I can say.
that leads me to I know that either Pauline or Marika, somebody raised this issue before, but I'd really like to kind of delve in and just ask, like, what is it that you really hope we keep from this, even as we move to vaccines and we move to herd immunity and being able to see each other's mouths again and smile at each other? But what is it? What are those key things that you're really hoping to keep?
Are you asking me or are you asking everyone?
No, well, Pauline, I would love to start with you and then anyone else that
Okay,
wants to
sure.
jump in.
That's a very good question. I think for me, I think the relationships that came together because they needed to, just to understand that, especially with, the whole other part of, I just want people to understand that we really do care and that we are there for you. And whatever you want us to do, we're going to do, because that's what we're supposed to do. The police are the community are the police, and they can't not they have to be like this, they can coexist in a wonderful, wonderful way. And I really do think once things, I don't know that they will settle down, but once things, if people can just understand that we will be there for you, we absolutely, and I know you guys will be there for us. We really believe that. It's been hard, but I think people can understand now that things are going to be better. And but I think the relationships and no, don't forget what people have done. Don't forget what people have done. They've been there for you. So.
Absolutely. I'd love to hear if anyone else has, ideas about that and things that they're really keen on making sure that we keep, even as we move away from the COVID era. Laura, yes, ma'am.
I hope we stay out of the gyms and back on the streets of our beautiful city, walking and biking outdoors instead of breathing all that gym air. I do hope your police get their gym back, Pauline. I understand. I understand that. No, but for the rest of us, keep walking the streets of this city.
I agree. Let's get some more green areas, though. There's too many buildings going up. We need some more open space.
Yep. I discovered beautiful parks all over the city this year.
I think, Laura, you need to write something about that. You need to write a blog or some kind of documentation of what you did just walking around the city and everything you discovered. So,
for those who don't know, my husband and I walked every street of Cambridge in the last 13 months.
Oh, that's outstanding.
Yeah, there's a young woman who's been doing it and blogging. I don't want to take anything away from her. She and we finished at about the same time. So anybody ever want to know where our fire trucks get fixed? I can tell you.
Great. Oh my goodness.
I'm just really curious about like the muscle memory that we've created around COVID and like what's going to continue like in a good way, you know, just these actions of giving, you know, it's interesting to hear that donations happen every Tuesday, right? Like at what point are we like, no, we don't need to do this anymore and we don't need to look out for each other anymore. I hope that that doesn't go away, that we can still continue those. But
Yeah, I remember that when there was no traffic, that was lovely. But it's back. So it's definitely back. Things are going to get busier. And so I agree with you. We need to remember all those little things that make a huge, huge difference in people's lives, for sure.
Absolutely. Wow.
I also think it's so cool that there's so many people on this very cool, is it a commission? It's a historical commission, right?
This is, the society. Yep. Society. The commission. We like to say the commission tells you what you can do with your house. We don't care what color you paint your house. We don't care if you have a fence or how high it is. And we also, speaking of partnerships, we work very closely together with them. But they are the ones that are the official city institution that are in charge of buildings and things like that. So.
Very cool. This is very, very cool. I really highly enjoyed every second of it. This is really awesome. Maybe I'll become a historian.
You absolutely should be. We will make you an honorary member, friend for life. We have some new swag that's coming out, so we will definitely put you on our list. You'll be one of the first to get your swag. It'll be in competition if you ever get that cool handmade police mask. You might be like, oh, do I wear this or do I wear my Cambridge historical mask? I don't know.
Whichever one fits better.
Well, thank you so much. We're coming to the end of our hour together, but I just wanted to thank you, Pauline, so much for being with us, for joining us, for thinking through all of this stuff, and thank you for all of your work. I can't even imagine what it's been like for this past 13 months for you, and of course the 25 plus years before that. But we're so grateful for you and for all of our officers and for everyone that's serving the public, and we just really, really appreciate it. And thank you for taking time out of your very busy schedule to be here with us. And thank you to everybody who was here and joined us and contributed. We're just thrilled to be able to keep having conversations like this. It's so important. And be on the lookout. Don't forget, tomorrow you're going to get a survey. We very much value your feedback, and we'd love to hear what you loved about the program and ways that we can make our programs even better in the future. So thank you all. Have a wonderful evening, and keep that partnership up. Keep that community spirit. So thank you all.
Thank you very much. And if you ever need anything, feel free to reach out. Anything at all.
Thank you so much. Take care.